Welcome back to our journey in grief. We're continuing the process of sharing about complicated grief. Remember in Module 104, Session 1, we learned that there are two primary reactive emotions in grieving. The first was a good, healthy experience, and the second is the complicated experience. The term healthy does not mean that the grief process has gone easy, smooth, without heartache or emotional turmoil. But what it does mean is that the person has resolved issues and that their road to recovery has been of significant importance. Welcome back to Module 106, Session 2. In this session, we're going to be talking about delayed grief. And we want to share some thoughts about it. Because delayed grief has its own unique characteristics. It occurs whether by plan or omission. The grieving process is sort of put on hold. Have you ever had a time that you wanted to do something or say something and either someone has told you or you have decided yourself not to do it at that time? Perhaps a few hours, a week, or a month later seemed like a better time to do whatever it was that you had wanted to do or say. You or someone or some circumstance caused you to put off what you wanted to do. No matter how badly you wanted to do it, it was put off. The action was delayed, maybe by something beyond your control, or maybe someone interfered with the process, but it was delayed. That is a lot of what delayed grief is like. Sometimes grievers will choose to delay the grief, and other times someone else or some circumstance delays the grief. Welcome back to Module 106, Session 3. In this session, we're going to be talking about chronic grief, also known as stuck grief. Chronic grief manifests itself in the grieving person when there is a repetition of the various stages of the grieving process. Like a chronic headache, the pain never diminishes. It's just always present. It's always an emotional pain that just won't go away. This is also being referred to as being stuck in the grieving process. Chronic grief can last for a prolonged period of time. Chronic grief continues in emotional distress periods. Chronic grief does not come and go, it's always present. There is no forward momentum in the healing process and the journey of grief. Chronic grief is a grief which exceeds a year with little or no healing. The pain is just as pronounced today as it was perhaps a year ago.